My last point is the one which has created, I guess, the maximum amount of controversy.
Uh,
Every time one discusses about Ayurveda versus allopathy versus homeopathy versus the other pathy, and the fact that anybody who looks at it, who looks at any of these traditional medicines or
yeah.
traditional sciences through the lens of allopathy, always labels it. So you have the entire, the pathis talking about and talking against each other. How do you see Ayurveda versus allopathy? Is it a competition? Is this about collectiveness? How do you see this?
Mr. Rana, it's a very, very appropriate question at a right time when government of India is now trying for one nation, one health approach.
Right.
And we have seen some uh, very, very altered responses the last few months.
Sure.
I find lot of ignorance among the professionals from both the studies
Right.
when talking about conflict between Ayurveda and allopathy.
Okay.
Charak Samhita has recommended to adopt anything which is new
Mhm.
in different times.
Right.
So large-hearted. Therefore, I personally do not see any competition in Ayurveda and allopathy. Rather, I see lot of scope of complementing the strengths of each other.
Interesting.
To cite few real life examples, we all know that when our children fall sick, we normally prefer homeopathy over allopathy.
Right. Right. Right.
Maybe as a male member, you would like to go to allopathy, but your wife will say, no, no, let us take to
Correct.
homeopathy.
Correct.
Right? So that's one. During acute conditions like severe infections or heart attack, it is only allopathy which can treat it.
That is so.
However, when it comes to chronic lifestyle disorders like arthritis, indigestion, constipation, and complications of certain diseases,
Uh-huh.
Ayurveda is the preferred option. So personally, I do not see any competition. Rather, I see lot of strength in both of them coming together for the benefit of the human being. To cite few more examples, I was involved in a clinical trial on terminally Arjuna, bark of Arjuna tree in
Mm.
congestive heart failure with Professor Maulik at All India Institute of Medical Sciences, New Delhi. We were supposed to recruit only 100 patients of chronic heart disease at AIMS with criteria that patients should not be taking Arjuna on their own.
Right.
To our surprise, we came to know that most of the patients were already consuming Arjuna on their own, and it took us about 1 year to recruit that one small number of patients at a center like AIMS. The point I wanted to convey is that when a patient comes back home from ICU due to heart attack, he starts taking Arjuna, which has good reputation of being cardioprotective to prevent occurrence of another heart attack on his own. This is a perfect example of complementing the strengths of each other. While
Right.
acute condition was taken care of by allopathy, Ayurveda was used to prevent the recurrence of heart attack by patient himself. I see no reason why an allopathic doctor cannot prescribe it to such patients like low dose aspirin as a blood thinner. Similarly, you will hardly find a patient of diabetes in India who does not take neem, jamun, or karela on his own. There are multiple other examples like arthritis also, where combination therapy is almost routine. Issue
Right.
is why can we not consider integrating both of them to provide benefits of both the systems to the patients? Currently, government is working on One Nation, One Health project. I have suggested a new model of integrated healthcare in an article on One Nation, One Health. I have
Right.
suggested integration of 75% Ayush and 25% of modern medicine and primary healthcare in the villages and 50-50 at district hospital and 75% modern medicine and 25% Ayurveda at tertiary hospitals. But all of them under one roof.
Interesting.
In the last 2 to 3 years, we have witnessed multiple efforts by Government of India on integration of healthcare and very strong reaction from Indian Medical Association to this idea. I think it needs change of mindset by the members of IMA to face reality of poor healthcare infrastructure in India and the support concept of one integrative healthcare under the project One Nation, One Health. That would be the most ideal. Therefore, I personally, at my level, I do not see any conflict. Rather, they can complement the strength of each other.
Right, right, right.
I hope it replies.
Oh yes, Dr. Saab, thank you so much for this. This was really eye-opening. More than the aspect of if I was to simply say that we were talking about interesting points about Ayurveda, there are so many bits in the way one looks at Ayurveda and so many myths that one actually has. It was interesting to dispel a lot of myths and actually get to know so very many new interesting facts about Ayurveda. Thank you so much for sharing your knowledge with us, Doctor. Thank you once again.
Thank you, Mr. Rana, for giving me opportunity, and it will be my pleasure to talk you sometime in future on still unknown facts facets of Ayurveda. Because Ayurveda suggests it is better to commit suicide rather than going to a quack for treatment.
Wow, you've left it, this particular thing has been left.
So
Wonderful.
sometime we will discuss even 3,000 years ago there were quacks. It's not the problem of today only. It was that time also.
This is so interesting, Doctor. That becomes, as they say, at the end of an episode, when a person says, "Agle season में क्या होएगा?"
Right.
आपने Doctor,
Right.
thank you so much for doing this for with us. Really appreciate it.
Thank you. Thank you.